Hi, welcome back to the channel. This is Jen, your Medicare and retirement guide. And today we're doing a new set of the series of the internet's most searched questions in terms of Medicare coverage. My Parents Are Aging edition. So if you like this type of content, please like, subscribe, share, comment down below on what are the most stressful questions that you're facing when it comes to your healthcare coverage. I would love to know, and I would love to cover those topics. So we're going to get started on the very first question here. So today we're just going to cover general Medicare questions that most of us, young millennials, Gen Zers, are probably going to be faced with the moment our parents hit age 65. So it's really important that you understand what's going to happen when you have an aging parent so that you don't get caught the way that I was caught up when my parents turned 65. And I was so ill prepared. I don't want you to be in that same position. So let's get started. So let's hit up the first question. What's the difference between Medicare Parts A, B, C, and D? Now, if you haven't watched my Medicare 101, I go in super depth of what each part of Medicare is and all the different rules and concerns that you may have when getting Medicare's Part A, B, and C, and D. But for the sake of this video, the fast, easy thing, Medicare Part A, hospital. That will cover your parent the moment they go to the hospital and all the services that involve taking care of your parent within a hospital setting. Part B is everything outside of the hospital, the ancillary services, everything that has to do to prevent your parent from ending up in the hospital. So we're talking doctor's visits, their primary care doctor, their specialists if they have a chronic condition and they have to see a doctor who has a specialty, lab work, preventative care, everything that has to, again, ancillary services outside of the hospital, that is Part B. Part C is Medicare Advantage. So you must have A and B in order to qualify for Part C. So just make sure that your parent goes to Social Security, that they qualify for Part A and Part B of Medicare, and then that way they can figure out if they would like to have Part C that includes extra benefits like dental, vision, hearing, which is not covered in Medicare Part A and B, and it will also include their prescription drug coverage, which is Part D. So if your parent decides, I'm not going to do Medicare Advantage, I'm just going to have Medicare A and B, make sure that they sign up for a Part D prescription drug plan, because if they do not, they will get hit with that penalty and end up losing money because they just forgot to sign up for a Medicare Part D plan. So make sure you don't get caught up in those situations where your parent forgets to sign up for these different programs because they may be losing out on a lot of benefits that they're entitled to, or they get charged with that penalty if they do not sign up in time. So the next question we have here is, do my parents need to enroll in Medicare if they're still working or have other insurance? So the answer is it depends, right? So if they have credible coverage through an employer, the company itself that your parents are working at needs to have 20 or more employees for it to count as credible coverage. They can delay their Part B. So if your parents have worked for 10 or more years and have paid taxes to Uncle Sam for 10 or more years in the US, then they can get their Part A for free and they can delay their Part B. Their Part B is going to be the monthly premium that your parents are going to pay every single month. Starting in 2025, the minimum is $185. The minimum. Depending on the tax bracket your parent falls under, it will go up from there. They can delay, again, their Part B if they have credible coverage through their employer. So the next question we have here, which we touched upon a little bit just now, when exactly do they need to enroll to avoid penalties? So that is called initial enrollment period. So that is 3 months before the birthday month of your parent and then 3 months after their birthday month. So we're talking a 7-month period where they can go ahead and sign up when they turn 65. They go to Social Security office. They set up an appointment with a Social Security agent that will go over their retirement options. Do you want Part A? Do you want to delay your Part B? Do you still work? Are you still going to work past the age of 65? And do you want your retirement check? Now, there are different types of tax penalties for a parent who is still working and would like to have their retirement check. Again, this is something that they will have to go and discuss with the Social Security agent to see what is going to turn out to be the best for them, so that they don't get hit with too many taxes and or avoid the penalties of what programs they can qualify for at this time. Next question we have here. What is the best Medicare plan for someone with multiple chronic conditions? So that is typically called a chronic condition special needs plan, or a CSNP. So that is a comprehensive Medicare supplement plan, like a Part G or a Plan G or a strong Part D plan. So essentially what that means is if you have a parent who has multiple chronic conditions, we're talking like diabetes, cancer, heart disease, they qualify for a Medicare Advantage plan that is called the chronic special needs plan. And with those types of plans, those are custom-made plans made for a person who suffers from long-term chronic conditions. With that said, that will require them to be part of a medical group. If your parent has multiple doctors from different hospital systems, different medical groups, they may want to look into a supplemental plan to help pay for the Part A deductible, which is around $1,700 if they end up in the hospital, or 20% of Part B payments to any of the specialists and or primary care physicians. Usually a supplemental plan will step in and help pay and subset those costs. So those would be my suggestions to kind of think about, if you have a parent who is suffering from a chronic condition. What happens if my parent misses their initial enrollment period? Okay, so they may need to wait for the general enrollment period, which is from January 1st to March 31st. So they may have to wait for Social Security to go in and sign up for that period for their Part A and their Part B, and they might face a lifetime penalty for Part B or for Part D if they did not have credible coverage and they signed up too late. Usually that penalty is around 10% for Part B, and then for Part D is 1% for every month that they did not sign up for Part B. So those are certain things to keep in mind for when your parent is aging, turning 65, so that they can go ahead and avoid those penalties, save money on taxes, and make sure that they are signed up for the correct plan according to their physiological needs. So this is the series, by the way. So this is just the first video of this series of My Parent is Aging, the internet's most searched questions in terms of Medicare coverage. If you like this video and this type of content, please consider sharing, like, subscribing below. And when you're ready, go ahead, click my link in the description below, and I would love to go over your Medicare option plans. Other than that, I hope you have yourself an excellent and healthy day, and I'll see you on the next one. Bye-bye.